RN Prometric Exam Collection 101 to 120. Part 6. 101. A home care nurse visits a pregnant client who has a diagnosis of mild preeclampsia. Which assessment finding indicates a worsening of the preeclampsia and the need to notify the physician? 1. Urinary output has increased. 2. Dependent edema has resolved. 3. Blood pressure reading is at the prenatal baseline. 4. The client complains of a headache and blurred vision. The answer is 4. The client complains of a headache and blurred vision. Rationale: if the client complains of a headache and blurred vision, the physician should be notified because these are signs of worsening preeclampsia. Options 1, 2, and 3 are normal signs. 102. A stillborn infant was delivered in the birthing suite a few hours ago. After the delivery, the family remained together, holding and touching the infant. Which statement by the nurse would further assist the family in their initial period of grief? 1. What can I do for you? 2. Now you have an angel in heaven. 3. Don't worry, there is nothing you could have done to prevent this from happening. 4. We will see to it that you have an early discharge so that you don't have to be reminded of this experience. The answer is 1. What can I do for you? Rationale: when a loss or death occurs, the nurse should ensure that parents have been honestly told about the situation by their physician or others on the healthcare team. It is important for the nurse to be with the parents at this time and to use therapeutic communication techniques. The nurse must also consider cultural and religious practices and beliefs. Option 1 provides a supportive, giving, and caring response. Options 2, 3, and 4 are blocks to communication and devalue the parent's feelings. 103. A nurse implements a teaching plan for a pregnant client who is newly diagnosed with gestational diabetes mellitus. Which statement made by the client indicates a need for further teaching? 1. I should stay on the diabetic diet. 2. I should perform glucose monitoring at home. 3. I should avoid exercise because of the negative effects on insulin production. 4. I should be aware of any infections and report signs of infection immediately to my healthcare provider. The answer is 3. I should avoid exercise because of the negative effects on insulin production. Rationale: exercise is safe for a client with gestational diabetes mellitus and is helpful in lowering the blood glucose level. Dietary modifications are the mainstay of treatment, and the client is placed on a standard diabetic diet. Many clients are taught to perform blood glucose monitoring. If the client is not performing the blood glucose monitoring at home, it is performed at the clinic or healthcare provider's office. Signs of infection need to be reported to the healthcare provider. 104. A pregnant client in the last trimester has been admitted to the hospital with a diagnosis of severe preeclampsia. A nurse monitors for complications associated with the diagnosis and assesses the client for 1. Enlargement of the breasts. 2. Complaints of feeling hot when the room is cool. 3. Periods of fetal movement followed by quiet periods. 4. Evidence of bleeding, such as in the gums, petechiae, and purpura. The answer is 4. Evidence of bleeding, such as in the gums, petechiae, and purpura. Rationale: severe preeclampsia can trigger disseminated intravascular coagulation, DIC, because of the widespread damage to vascular integrity. Bleeding is an early sign of DIC and should be reported to the healthcare provider if noted on assessment. Options 1, 2, and 3 are normal occurrences in the last trimester of pregnancy. 105. A nurse in a maternity unit is reviewing the records of the clients on the unit. Which client would the nurse identify as being at the greatest risk for developing disseminated intravascular coagulation? 1. A prima gravida with mild preeclampsia. 2. A prima gravida who delivered a 10 pounds infant 3 hours ago. 3. A gravida 2 who has just been diagnosed with dead fetus syndrome. 4. A gravid of 4 who delivered 8 hours ago and has lost 500 milliliters of blood. The answer is 3. A gravid 2 who has just been diagnosed with dead fetus syndrome. Rationale: in a pregnant client, disseminated intravascular coagulation, DIC, is a condition in which the clotting cascade is activated, resulting in the formation of clots in the microcirculation. Dead fetus syndrome is considered a risk factor for DIC. Severe preeclampsia is considered a risk factor for DIC, a mild case is not. Delivering a large infant is not considered a risk factor for DIC. Hemorrhage is a risk factor for DIC, however, a loss of 500 milliliters is not considered hemorrhage. 106. A client in the first trimester of pregnancy arrives at a healthcare clinic and reports that she has been experiencing vaginal bleeding. A threatened abortion is suspected, and the nurse instructs the client regarding management of care. Which statement made by the client indicates a need for further instructions? 1. I will watch for the evidence of the passage of tissue. 2. I will maintain strict bed rest throughout the remainder of the pregnancy. 3. I will count the number of perineal pads used on a daily basis and note the amount and color of blood on the pad. 4. I will avoid sexual intercourse until the bleeding has stopped, and for 2 weeks. Following the last evidence of bleeding. The answer is 2. I will maintain strict bed rest throughout the remainder of the pregnancy. Rationale: strict bed rest throughout the remainder of the pregnancy is not required for a threatened abortion. The client is advised to curtail sexual activities until bleeding has ceased and for 2 weeks after the last evidence of bleeding or as recommended by the physician or other healthcare provider. The client is instructed to count the number of perineal pads used daily and to note the quantity and color of blood on the pad. The client also should watch for the evidence of the passage of tissue. 107. The nurse is assessing a pregnant client with type 1 diabetes mellitus about her understanding regarding changing insulin needs during pregnancy. The nurse determines that teaching is needed if the client makes which statement? 1. I will need to increase my insulin dosage during the first 3 months of pregnancy. 2. My insulin dose will likely need to be increased during the second and third trimesters. 3. Episodes of hypoglycemia are more likely to occur during the first 3 months of pregnancy. 4. My insulin needs should return to normal within 7 to 10 days after birth if I am bottle feeding. The answer is 1. I will need to increase my insulin dosage during the first 3 months of pregnancy. Rationale: insulin needs decrease in the first trimester of pregnancy because of increased insulin production by the pancreas and increased peripheral sensitivity to insulin. The statements in options 2, 3, and 4 are accurate and signify that the client understands control of her diabetes during pregnancy. Test taking strategy: note the strategic words teaching. 108. A pregnant client reports to a healthcare clinic, complaining of loss of appetite, weight loss, and fatigue. After assessment of the client, tuberculosis is suspected. A sputum culture is obtained and identifies Mycobacterium tuberculosis. The nurse provides instructions to the client regarding therapeutic management of the tuberculosis, and the nurse tells the client that 1. Therapeutic abortion is required. 2. She will have to stay at home until treatment is completed. 3. Medication will not be started until after delivery of the fetus. 4. Isoniazid, INH, plus rifampin, Rifidin, will be required for 9 months. The answer is 4. Isoniazid, INH, plus rifampin, Rifidin, will be required for 9 months. Rationale: more than one medication may be used to prevent the growth of resistant organisms in a pregnant client with tuberculosis. Treatment must continue for a prolonged period. The preferred treatment for the pregnant client is isoniazid, INH, plus rifampin daily for 9 months. Ethambutol is added initially if medication resistance is suspected. Pyridoxine, vitamin B6, often is administered with INH to prevent fetal neurotoxicity. The client does not need to stay at home during treatment, and therapeutic abortion is not required. 109. A nurse is providing instructions to a maternity client with a history of cardiac disease regarding appropriate dietary measures. Which statement, if made by the client, indicates an understanding of the information provided by the nurse? 1. I should increase my sodium intake during pregnancy. 2. I should lower my blood volume by limiting my fluids. 3. I should maintain a low-calorie diet to prevent any weight gain. 4. I should drink adequate fluids and increase my intake of high-fiber foods. The answer is 4. I should drink adequate fluids and increase my intake of high-fiber foods. Rationale: Valsalva maneuver should be avoided in clients with cardiac disease because it can cause blood to rush to the heart and overload the cardiac system. Constipation can cause the client to use Valsalva maneuver. High-fiber foods are important. A low-calorie diet is not recommended during pregnancy and could be harmful to the fetus. Diets low in fluid can cause a decrease in blood volume, which could deprive the fetus of nutrients, so adequate fluid intake and high-fiber foods are important. Sodium should be restricted as prescribed by the physician because excess sodium would cause an overload to the circulating blood volume and contribute to cardiac complications. Test-taking strategy: use the process of elimination. Think about the physiology of the cardiac system, maternal and fetal needs, and the factors that increase the workload on the heart. This will direct you to option 4. If you had difficulty with this question, review nursing measures for a pregnant client with cardiac disease. 110. A clinic nurse is performing a psychosocial assessment of a client who has been told that she is pregnant. Which assessment finding indicates to the nurse that the client is at high risk for contracting human immunodeficiency virus, HIV? 1. A client who has a history of intravenous drug use. 2. A client who has a significant other who is heterosexual. 3. A client who has a history of sexually transmitted diseases. 4. A client who has had one sexual partner for the past 10 years. The answer is 1. A client who has a history of intravenous drug use. Rationale: human immunodeficiency virus, HIV, is transmitted by intimate sexual contact and the exchange of body fluids, exposure to infected blood, and passage from an infected woman to her fetus. Clients who fall into the high-risk category for HIV infection include individuals with persistent and recurrent sexually transmitted infections, individuals who have a history of multiple sexual partners, and individuals who have used intravenous drugs. A client with a heterosexual partner, particularly a client who has had only one sexual partner in 10 years, does not have a high risk for contracting HIV. 111. A nurse in a maternity unit is providing emotional support to a client and her husband who are preparing to be discharged from the hospital after the birth of a dead fetus. Which statement made by the client indicates a component of the normal grieving process? 1. We want to attend a support group. 2. We never want to try to have a baby again. 3. We are going to try to adopt a child immediately. 4. We are okay, and we are going to try to have another baby immediately. The answer is 1. We want to attend a support group. Rationale: a support group can help the parents work through their pain by non-judgmental sharing of feelings. Option 1 identifies a statement that would indicate positive, normal grieving. Although the other options may indicate reactions of the client and significant other, they are not specifically a part of the normal grieving process. Test-taking strategy: read all the options carefully before selecting an answer and focus on the subject of the question, the normal grieving process. Note that options 2, 3, and 4 are comparable or alike in that they relate to childbearing. If you had difficulty with this question, review the components of the normal grieving process. 112. A nurse evaluates the ability of a hepatitis B positive mother to provide safe bottle feeding to her infant during postpartum hospitalization. Which maternal action best exemplifies the mother's knowledge of potential disease transmission to the infant? 1. The mother requests that the window be closed before feeding. 2. The mother holds the infant properly during feeding and burping. 3. The mother tests the temperature of the formula before initiating feeding. 4. The mother washes and dries her hands before and after self-care of the perineum. The answer is 4. The mother washes and dries her hands before and after self-care of the perineum. Rationale: hepatitis B virus is highly contagious and is transmitted by direct contact with blood and body fluids of infected persons. The rationale for identifying childbearing clients with this disease is to provide adequate protection of the fetus and the newborn, to minimize transmission to other individuals, and to reduce maternal complications. Option 4 provides the best evaluation of maternal understanding of disease transmission. Option 1 will not affect disease transmission. Options 2 and 3 are appropriate feeding techniques for bottle feeding, but do not minimize disease transmission for hepatitis B. 113. A nurse in a delivery room is assisting with the delivery of a newborn. After delivery, the nurse prepares to prevent heat loss in the newborn resulting from evaporation by 1. Warming the crib pad. 2. Closing the doors to the room. 3. Drying the infant with a warm blanket. 4. Turning on the overhead radiant warmer. The answer is 3. Drying the infant with a warm blanket. Rationale: evaporation of moisture from a wet body dissipates heat along with the moisture. Keeping the newborn dry by drying the wet newborn at birth prevents hypothermia via evaporation. Hypothermia caused by conduction occurs when the newborn is on a cold surface, such as a cold pad or mattress, and heat from the newborn's body is transferred to the colder object, direct contact. Warming the crib pad assists in preventing hypothermia by conduction. Convection occurs as air moves across the newborn's skin from an open door and heat is transferred to the air. Radiation occurs when heat from the newborn radiates to a colder surface, indirect contact. 114. The mother of a newborn calls a clinic and reports to a nurse that when cleaning the umbilical cord, the mother noticed that the cord was moist and that discharge was present. The appropriate nursing instruction to the mother is which of the following? 1. Bring the infant to the clinic. 2. This is a normal occurrence. 3. Increase the number of times that the cord is cleaned per day. 4. Monitor the cord for another 24 to 48 hours and call the clinic if the discharge continues. The answer is 1. Bring the infant to the clinic. Rationale: symptoms of umbilical cord infection are moistness, oozing, discharge, and a reddened base around the cord. If symptoms of infection occur, the client should be instructed to notify a healthcare provider. If these symptoms occur, antibiotics may be necessary. Options 2, 3, and 4 are inappropriate nursing interventions for the description given in the question. 115. A nurse in a newborn nursery is monitoring a preterm newborn for respiratory distress syndrome. Which assessment signs noted in the newborn would alert the nurse to the possibility of this syndrome? 1. Tachypnea and retractions. 2. Acrocyanosis and grunting. 3. Hypotension and bradycardia. 4. Presence of a barrel chest with acrocyanosis. The answer is 1. Tachypnea and retractions. Rationale: the highest priority on admission to the nursery for a newborn with a low APGAR score is the airway, which would involve preparing respiratory resuscitation equipment and oxygen. The remaining options are also important, although they are of lower priority. The newborn would be placed on an apnea and cardiorespiratory monitor. Setting up an intravenous line with 5% dextrose and water would provide circulatory support. The radiant warmer would provide an external heat source, which is necessary to prevent further respiratory distress. Circulatory support. The radiant warmer would provide an external heat source, which is necessary to prevent further respiratory distress. 116. A postpartum nurse is providing instructions to the mother of a newborn with hyperbilirubinemia who is being breastfed. The nurse provides which appropriate instruction to the mother? 1. Feed the newborn less frequently. 2. Continue to breastfeed every 2 to 4 hours. 3. Switch to bottle feeding the infant for 2 weeks. 4. Stop breastfeeding and switch to bottle feeding permanently. The answer is 2. Continue to breastfeed every 2 to 4 hours. Rationale: hyperbilirubinemia is an elevated serum bilirubin level. At any serum bilirubin level, the appearance of jaundice during the first day of life indicates a pathological process. Early and frequent feeding hastens the excretion of bilirubin. Breastfeeding should be initiated within 2 hours after birth and every 2 to 4 hours thereafter. The infant should not be fed less frequently. Switching to bottle feeding for 2 weeks or stopping breastfeeding permanently is unnecessary. 117. A nurse notes hypotonia, irritability, and a poor sucking reflex in a full-term newborn on admission to the nursery. The nurse suspects fetal alcohol syndrome and is aware that which additional sign would be consistent with fetal alcohol syndrome? 1. Length of 19 inches. 2. Abnormal palmar creases. 3. Birth weight of 6 pounds, 14 ounces. 4. Head circumference appropriate for gestational age. The answer is 2. Abnormal palmar creases. Rationale: fetal alcohol syndrome is caused by maternal alcohol use during pregnancy. Features of newborns diagnosed with fetal alcohol syndrome include craniofacial abnormalities, intrauterine growth restriction, cardiac abnormalities, abnormal palmar creases, and respiratory distress. Options 1, 3, and 4 are normal assessment findings in the full-term newborn infant. 118. A nurse is preparing a plan of care for a newborn with fetal alcohol syndrome. The nurse should include which priority intervention in the plan of care? 1. Allow the newborn to establish own sleep-rest pattern. 2. Maintain the newborn in a brightly lighted area of the nursery. 3. Encourage frequent handling of the newborn by staff and parents. 4. Monitor the newborn's response to feedings and weight gain pattern. The answer is 4. Monitor the newborn's response to feedings and weight gain pattern. Rationale: fetal alcohol syndrome is caused by maternal alcohol use during pregnancy. A primary nursing goal for the newborn diagnosed with fetal alcohol syndrome is to establish nutritional balance after delivery. These newborns may exhibit hyperirritability, vomiting, diarrhea, or an uncoordinated sucking and swallowing ability. A quiet environment with minimal stimuli and handling would help establish appropriate sleep-rest cycles in the newborn as well. Options 1, 2, and 3 are inappropriate interventions. 119. A nurse administers erythromycin ointment, 0.5%, to the eyes of a newborn and the mother asks the nurse why this is performed. The nurse explains to the mother that this is routinely done to 1. Protect the newborn's eyes from possible infections acquired while hospitalized. 2. Prevent cataracts in the newborn born to a woman who is susceptible to rubella. 3. Minimize the spread of microorganisms to the newborn from invasive procedures during labor. 4. Prevent ophthalmia neonatorum from occurring after delivery in a newborn born to a woman with an untreated gonococcal infection. The answer is 4. Prevent ophthalmia neonatorum from occurring after delivery in a newborn born to a woman with an untreated gonococcal infection. Rationale: erythromycin ophthalmic ointment 0.5% is used as a prophylactic treatment for ophthalmia neonatorum, which is caused by the bacterium Neisseria gonorrhoeae. Preventive treatment of gonorrhea is required by law. Options 1, 2, and 3 are not the purposes for administering this medication to a newborn infant. 120. A nurse prepares to administer a vitamin K injection to a newborn, and the mother asks the nurse why her infant needs the injection. The best response by the nurse would be 1. Your newborn needs vitamin K to develop immunity. 2. The vitamin K will protect your newborn from being jaundiced. 3. Newborns have sterile bowels and vitamin K promotes the growth of bacteria in the bowel. 4. Newborns are deficient in vitamin K, and this injection prevents your newborn from bleeding. The answer is 4. Newborns are deficient in vitamin K, and this injection prevents your newborn from bleeding. Rationale: vitamin K is necessary for the body to synthesize coagulation factors. Vitamin K is administered to the newborn to prevent bleeding disorders. Vitamin K promotes liver formation of the clotting factors 2, 7, 9, and X. Newborns are vitamin K deficient because the bowel does not have the bacteria necessary for synthesizing fat-soluble vitamin K. The normal flora in the intestinal tract produces vitamin K. The newborn's bowel does not support the normal production of vitamin K until bacteria adequately colonize it. The bowel becomes colonized by bacteria as food is ingested. Vitamin K does not promote the development of immunity or prevent the infant from becoming jaundiced.